Hello, this is Dr. Bouvier with Dr. and You, and you came to this video as a CNA or a caregiver, to learn a little bit more about what we want you to document on the chart for the congestive heart failure program patients, right?
Yes, correct.
And you know Michelle.
Hi.
Robert Bouvier, I'm a physician here, a consultant for CHF with Tender Care, and you've come to this video as a CNA or caregiver to understand a little bit more about the documentation and it correlates with this pre and post test. Did I do that right? Yeah, there we go. Pre and post test, right? So there's two things we want to document, right?
Correct.
The green, yellow, red, which is a subjective feeling that comes from the patient,
Yep.
and we've got a set of questions here
Yep.
that we're going to explain. But again, it's the first thing is subjective, meaning what is the patient telling us after the questions we ask them, and that whole thing should take about what, 30 seconds maybe?
30 seconds.
Yeah, and then you take the patient's weight. This is the second thing we wanted to document.
Yep.
And what's the criteria again?
If they gain more than 3 pounds in 48 hours, to contact the physician or provider, or if they lose 3 pounds in 48 hours.
Now they
Also
can bring that to your
contact,
attention
Yep,
as well,
and they can
right?
also bring that to my attention, so I'm able to discuss that with you.
Yeah, remember, you're not alone in this. When we've done these programs in other areas of the country, the success and failure has been whether the CNAs and the frontline providers, the caregiver or the CNA, is communicating and asking these questions.
Definitely.
And we can preempt a hospitalization. Because what's our ultimate goal here? Our ultimate goal here is to help people have better quality, live longer, better quality while they're living, but not have to go back to the hospital so often.
Yes.
And to catch these exacerbations of their congestive heart failure early, we're talking 12 hours to 24 to even days before they crump, and
Yeah.
you got 911 call the office, well, call the hospital, right? So you guys are the linchpin that really makes this work or not work. So it's really kind of neat. So let's go over the two documentation pieces. The first documentation is a subjective thing coming from the patient themselves. It's green, yellow, or red.
Yep.
So go ahead and explain the three things that in 30 seconds you'll be asking these patients.
So we'll be asking the patients if they're having any shortness of breath today. Is it occurring more so during the day or at night? Do they have a cough? Is it a night cough during the day? The second question we're going to ask them is, are they having any edema? Are their clothes feeling a little bit tighter today? Are they feeling as if they've gained weight? We're also going to be doing that assessment. Number 3 is, are they feeling okay today? Overall status on how are they feeling? Do they feel good? Do they feel bad? Why are they feeling bad? So this is just 3 questions that we're able to ask them in a 30-second time span.
And then you'll be able to document, the CNA will be able to document. Right next, I think we decided that we're going to write the weight down, and then right next to that, it'll either be G, yellow, or red. So if they're the same as yesterday and they feel good, and it's their kind of their baseline, they're doing pretty good, then they're green. If the day before, and by the way, you'll be educating the patients yourselves, okay? The patients will get to know the questions and say, oh, here's my answer to this, this, and this, and you can get it done in 15 seconds.
Yeah, but it'll be automatic.
So and over time, the patients really become good at this, and most of the time they're confused, they don't understand your question, and but over time, you ask it 3 or 4 times, within a week they get it.
Yeah, and they know it's going to benefit them.
Right,
so.
and they'll go through an example sometime in the next couple of months because they'll probably exacerbate. So again, there's the first documentation piece is going to be green, yellow, or red. Green feeling great, yellow meaning okay, there's a change in the shortness of breath, edema, or feeling good. Red is like it's an emergency.
Yeah,
it's really
kind of like a stoplight.
Yeah, it's kind of like
green,
like
you're good.
Stop what you're doing. Go get the medical
Exactly.
person. They're
It's
either
time.
on their way. It's time.
Yeah.
So shortness of breath and cough during the day or night. Edema, clothes fitting tighter, feeling they've gained weight, and number 3, are they feeling okay for the day? So the second thing is a daily weight. And we're not doing it daily. We're doing it Monday, Wednesday, and Friday.
Correct.
Right?
Yeah.
So there's a spot on the chart, on the paper chart, that you can put that weight in there, and then the other documentation piece is whether they're going to be G, Y, or red, corresponding with green, yellow, or red. So again, tell them what the weight criteria is again.
If they gain more than 3 pounds in 48 hours, to contact myself or the provider.
So what if they lose 3 pounds?
also contact myself or the provider, because
In-
that can be,
in a
you know,
2-day time period.
Yep.
So we can
exactly,
actually, so we can actually cut down on the diuretic,
Yep.
you know, when we
Catch
actually
things
lose
before
too
they
much.
get worse.
Right.
So.
And in the chart, we've documented, you know, what's their base weight. If you don't know what it is, you know, we'll have it documented in the chart what their, you know,
Yep.
what their base weight is. So did we get everything done here?
I
If there's
think
any
we did.
questions, I think we got it.
I think we do.
So if you this goes along with the pre-test, okay? And this is the second video for that. You may want to review the first video. So if you have any questions, please ask Michelle. Give me a call, 810-610-7972, 810-610-7972. And you know where Michelle is.
Yep.
She's easily accessible. And we'll make sure that every single one of you really truly understand what this is, and you will make a major impact on your patients. They are
Definitely.
your patients, and
Yes.
we appreciate that.
We appreciate everything you
And
do.
all the doctors that come here really appreciate it too.
Definitely.
Yeah, this is Dr. Bouvier with Dr.
All right.
Mew and Michelle.
Michelle.
Thank you very much.
Thank you.